So hi, my name is Dr. Brenda and I'm a licensed clinical psychologist at Westside Children's Therapy. I wanted to create this video just to help guide parents as to what to expect with the testing process, as I feel like sometimes it's a little bit daunting. So we typically see like a bunch of referrals from individuals that are close to the child, like physicians, therapists, teachers, that typically occur when there's some difficulties or you're feeling like you're stuck with your child because they're not really making the progress, or they're having a bunch of behavioral or emotional difficulties across the different settings. And that's when they prompt a psychological evaluation and I step in. So at Westside, we have a 3-session model approach. At the initial session, what we talk about is just getting an idea of what concerns the family has, and trying to get a more comprehensive view of their strengths and the areas they kind of struggle with. And this kind of really informs what types of measures I will use for my diagnostic testing session. Which brings us to session number 2. At the testing session, it's usually a one-on-one type of setting with me and the client. And what we do is we do like a bunch of little games that we kind of to get an idea of their thinking and reasoning abilities. We do attention tasks and just projective measures to get an idea of how they perceive themselves as well as the world around them. And then the third session is the feedback, which is with the child and the family together. I know sometimes some kids can't really pay attention because of their age or lack of engagement. That's okay. What this session is primarily targeted for is just if we can talk about the results of the evaluation and talk about the relevant history, the measures that we administered, the rating scales that parents filled out either in person or via an email link for telehealth appointments, and what diagnoses are relevant, and more importantly, the recommendations that will be helpful for supporting the child. And the big takeaway from this is that you will kind of get a better idea and clarity about what your child needs in order to thrive and to kind of be their best self. And then older children can learn more about their learning styles and the way that they think and just more about themselves in general. If you have any questions, feel free to reach out and give us a call.